I'm Kevin Henner, President of the New York State Dental Association, and I'm so pleased to participate tonight in an incredibly informative and phenomenal presentation by the new New York State Commissioner of Health, Dr. Mary Bassett, entitled New York State of Health. However, before I introduce Dr. Bassett, again, we are honored by the participation, although likely brief, by our governor and long-term friend of the profession of dentistry, even well before she was leading the state of New York, Kathy Hochul. Governor Hochul, thank you again for all you've done for dentistry, the New York State Dental Association, and of course, the public we all serve. The list of your accomplishments is so considerable, so rather than listing it myself and listening to me, I'm sure the group would prefer hearing from you regarding your desires and aspirations moving forward, including your brief comments about your commissioner. However, Governor, the New York State Dental Association can't thank you enough for your ethic and actions during the height of the pandemic and your continued focus on the population of New York State. Governor Hochul, thank you again, and the microphone is yours.
Well, thank you, Kevin, and I hope you're enjoying being the president of this extraordinary association. I've had a chance to work with members since my days back in Congress. And I thank you for just keeping it all together during some of the most trying times your members could have ever envisioned. And your leadership has made a true difference. And I want to thank Roy Lasky for creating opportunities many times during the pandemic where I could connect with the members of the Dental Association and just answer questions and to address the anxieties we felt, especially as the days went into weeks, went into months with this pandemic. And people wanted to make sure they could provide their patients with often critical surgery or assistance, and they weren't sure if they could get together, or even well visits that were suspended for a long time. And it really had an effect on the overall health of people, because we know the foundation of a healthy body is healthy teeth and healthy mouth. And we know that because so many diseases can spread from the mouth. And so we are cognizant of this. So we needed to make sure that people who worked in dentist offices were safe, but they could still continue to see their patients. And that's why the advent of having televisits, telehealth visits were so important, and a lot of virtual visits were important, but also reimbursement is important. If the incentive is not there to have a virtual or telehealth visit, then many practitioners, dental or doctors in the medical profession wouldn't do it. So we needed to level the playing field and make sure that the reimbursement is the same, as well as making sure that we increase our Medicaid reimbursements to cover more people for dental services. Really important for people who are at the lower end of the income spectrum, that they have access to the same opportunities as anyone else to make sure that they can lead a healthy life by having regular preventative dental care. So I thank you for that. So we proved that the dentist industry is an essential service. People recognize that. We could not shut it down. And with all the restrictions you had, your members came through with incredible grit and resilience that we still admire to this day. And also realized that during the pandemic, there's a lot, and you'll hear from Dr. Bassett about this, a lot of collateral damage during the pandemic. I mean, the healthcare system overall was really crippled because of, the strain on our healthcare systems, and what people had to endure in the hospitals and doctors' offices and dentists' offices really went through an incredibly difficult time. But I do feel we're turning the corner, and you'll hear from the person who monitors these numbers all day long. But I feel like we're seeing a little spike in numbers, but with people getting vaccinations and booster shots, and this is something I want to ask all of your members to remember, that people trust you. They show up in your office because you're a trusted advisor to them with respect to their overall health. And so I don't know if there's any reason not to, if there's an ethical reason not to talk about other areas of their health, but to suggest and say, well, have you had your vaccination? Have you had your booster? When you have a patient sitting in the chair, they can't really argue back if their mouth is full of something. So just say, hey, I hope you're thinking about your overall health and want to be sure that you don't contract COVID, you don't spread it to other people, not just in that office, but in other places. So it's really important what you can do. But I just want to thank all your members for sticking with us through the tough times. And one person who was at my side during the last 7 months or 6 months has been Dr. Mary Bassett. And everybody said when I was building a new administration, if you could get Dr. Mary Bassett to come back from Harvard, that would be the biggest catch of all. And she came with us. She's done an exceptional job. And I know she has a lot of wisdom to offer your members as part of this webinar. So I thank you just for the chance to say thank you for everything you've done during this, and we're going to continue to deepen our relationship. We need you as allies, and we also need to continue to hear the concerns that affect you of what Albany's doing and what happens in the legislature, because we want to make sure that we're building up your industry and not putting unnecessary roadblocks in your way. So I just want to say good night to everybody. Thank you for allowing me a chance to say hello. And Dr. Bassett, your reputation precedes you by years because of your tireless work in public health. No one ever dreamed that a public health expert would be in such high demand, but we are blessed to have her expertise and her demeanor and the way she handles the challenges of the job in such an incredible, compassionate, but professional way. So to Dr. Mary Bassett, I say thank you as well.
Okay, Governor.
Before you go, I want to
ahead.
thank you for all you've done and all you will continue to achieve. I can see he's chomping at the bit, so I'm sure Roy Lasky would like to say a few words before you sign off. So Roy?
Yes, I know you do have to leave, but in 2017, you were our keynote speaker for our lobby day, in Albany, and you have been supportive of us before then, at that time, and you met with our board of trustees. You consulted with us during COVID. You're the first governor in history who actually attended an NYSDA board meeting, and you're the first governor who addressed the whole membership today. And we're proud of our association with you, and we look forward to working with you for at least the next 8 years.
Thank you, Roy. I appreciate that, and thank you, Kevin. And take care, everybody. Look forward to seeing you soon.
Have a wonderful evening. Good night.
Thank you.
So with that, I certainly would like to say congratulations to Dr. Bassett on your well-deserved appointment, and I'm sure you'll serve New York State population well with your incredible talent and knowledge. Dr. Bassett, I am so pleased and honored to have you before us, as it's obvious to me that your focus and intentions are paramount to the directors of the New York State Dental Association, the profession of dentistry, and most important, the patients and the public we serve. Your bio, I must say, is beyond unique and amazing, but more so impressive. We have shared that with the audience so we can save a few hours of highlighting your incredible accomplishments tonight, but truly a leader. And we thank you for your leadership, especially when it comes to the concerns of the oral health of New York. Additionally, speaking of leadership, I must recognize my line officers, Dr. Galati, Dr. Cuomo, Dr. Ratner, Dr. Barnashek, and Dr. Gennardes, together with your board of trustees and our amazing staff of professionals, and of course, our renowned association lobbyist, Mr. Roy Lasky, who will comment more later, I'm sure. NYSDA is incredibly strong. Just some brief housekeeping. We will address questions at the end of the presentation, and please post your questions by pressing the Q&A icon at the bottom of your screen. In a moment, I'm going to hand the meeting over to Dr. Bassett, but I feel compelled to mention a few things, Commissioner, so you have a proper optic on how strongly we want to work together for the benefit of the patients and the public that we serve. Considering COVID, its vectors, and all of its sequelae, including teledentistry, opioids and their wrath, public health, Medicaid, and treating the underserved populations of oral health needs of New York, to name just a few issues. Our focus as the New York State Dental Association is the profession of dentistry and the New York population we serve. I'm sure you understand the ethic, Dr. Bassett. In fact, NYSDA supported our health law mandating continuing education and ethics, I believe the only one mandated within the healthcare realm. I apologize, I feel bad for going on, as I'm just so proud of the focus, the intent, and the accomplishments of NYSDA and the profession of dentistry. And Commissioner, I know we share your compassion for ensuring that the public has access to the appropriate oral health care they require and certainly deserve. Dr. Bassett, we need you and the public needs us. With that, I would like to introduce the New York State Commissioner of Health, Dr. Mary Bassett. Thank you so much for being here tonight. Mary, it's all yours.
All right, so unmute. They seem to pile up all of the fire drill announcements for the evening. So if you hear that going on in the background, I hope you'll bear with me. First of all, good evening to everyone. It's a real pleasure to join NYSDA, as I now know it's pronounced, the New York State Dental Association and talk with you a little bit about the state health department and our goals and plans. And I want to thank you, Dr. Henner, for the invitation to join you this evening. As I mentioned, as we chatted briefly before we got started, in the 4 months, and I've just finished 4 months, I'm now in my 5th, so that I've been the health commissioner, we've really been focused principally on the Omicron variant and its now various subvariants. As you know, we are now in the midst of another upturn of Omicron in the state, but all of the signs suggest that we will not see again the sort of stratospheric contagion that we saw in January with the Omicron variant. So we're beginning to turn to other issues, much to my relief. This is really an old and incredibly accomplished health department, and it's worked across a whole range of issues affecting public health, looking at regulation of the healthcare sector, and importantly, and a huge part of the department's budget, the Medicaid program. So the fact that we have these all under one roof gives this department the chance to link clinical care and public health, which is probably what most dentists do every day. And I'm really looking forward to beginning to broaden my own horizon from looking at the data every morning on COVID to beginning to think about these other important issues. When I'm preparing for my remarks this evening, I've learned that the American Dental Association was established in New York State over 150 years ago. It was August 3rd of 1859 when 26 dentists came together in Niagara Falls, and I sure hope this is accurate because you're the people who would know if it's not. In any case, it became the largest and oldest dental association in the world. And at the beginning, they put raising the ethics of the profession within the, let me just exit my, within the priorities of the association. And I know from talking with you, Dr. Henner, that this has remained an important plank in the association's commitments. So the association has promoted the dental profession, and it has promoted the health of the public, including their oral health. And you know, the governor, and with her usual elegance and succinctness, has covered many of the points that I am hoping to cover with you this evening. But center among them is the fact that oral health is not just a cosmetic issue. It is core to our personal health and to our overall health. And I mean, it stands to reason that the mouth is connected to the rest of the body. It is not an opinion that oral health is a critical component of public health. It's a fact. So we're now in our 3rd COVID year. It's hard to remember that we once had lives that were so different than they are now. As you've seen, we are beginning to figure out how to live with this virus. And it was extremely hard on all healthcare delivery systems, particularly on dental practices, which are also, let's be frank, often small businesses. And these all had to shut down except for very limited services. So there was a real effect on the economic well-being of practices and on their ability to serve the needs of the patients who they have. And this, dentists shared with many healthcare workers the suffering that we've seen, and also has extended to local health departments. It's estimated that close to 20% of healthcare workers may have slipped from the profession. So this has had a really devastating effect. But the Dental Association stepped up, and I apologize. Can you hear that?
Yeah, a little. That's okay.
Okay. Really stepped up. The ADA issued guidance for all dentists, urging them to perform only emergency and urgent procedures. And NYSDA followed this guidance, and the very next day adopted the ADA guidance on COVID. This is important because the health department doesn't really regulate that many dental practices, but you adopted these protective measures for both your dental practitioners and for your patients. And of course, dental hygienists were among those at risk. People who work in the dentist's office and in many ways are just like nurses on the front line. So it worked. You all know this, but I want to let you know that I know it, that the Centers for Disease Control determined that there were no clusters of COVID associated with a dental practice. So, I really hope that in all the hardship of the past couple of years, that you also can feel the pride of having done your part in addressing the pandemic. Like every health-related profession, you've had people decide to retire early. You've had the problem of lost revenue. You've had all of the burdens of the increase in COVID precautions. I just want to, as you heard, I personally was just sitting at Harvard while all this was going on. And I just always feel that it's part of my responsibility to acknowledge people who were there. While I sat in my Zooms and my lectures, you can see that I felt a strong pull to return to public service. And part of it was the response of this pandemic. And part of the reason that I always want to talk to people who work in dentistry is because of my own personal experience. Actually, this extended to the pandemic. My only personal healthcare need during the pandemic was for dental care. I was visiting my daughter in New Orleans when she just moved there, when I developed unrelenting dental pain. I called my dentist. I was not the health commissioner at that time. I don't know what I said, but I got a call back from my dentist in Boston, calling me in New Orleans to try and help take care of me. And he also later organized a root canal for me. All of us know that I don't have any primary medical doctor who I would think would be as responsive to me as the dentists in my life have been. I had the same dentist from the age of 5 until I finished my medical residency. So in many ways, you have among the more trusting relationships with your patients than those of us who are medical doctors, and you have more continuity of care. And this is something that one doesn't forget. Also, in my work as a public health researcher, at one point I worked at a Harlem hospital, a public hospital in New York City, and we were doing an old-fashioned community health survey, knocking on doors, not a telephone survey. It had all sorts of dramatic things associated with knocking on people's doors. But in any case, we asked people what were the number one health needs that they had. And it won't surprise you, but I must confess it surprised us that what this representative sample of a Harlem poor Black neighborhood identified dental care as their number one health problem. Now, we all know that it's not that often that you have anything like a heart attack from an oral health problem. But having healthy teeth is so important to dignity, to well-being, and to the rest of the health of our body. So for that reason, I've always considered it important that we take up more emphatically within public health that the importance of dental care. So, we know, and the governor mentioned that part of the reason that people identify dental care as a priority in poor communities is because they don't have enough access to dental care. And part of the reason they don't have enough access is because of the Medicare and Medicaid reimbursement rates. And so I want to, my talking points say, we want to acknowledge the frustration with the fees from managed care plans, which are often less than the Medicaid fee for service and may be impeding. So, you know, I'm not a politician, so let me just depart from my talking points and acknowledge that the fee structure is limiting access to necessary services, and it's something that we must address. At the same time, New York State, of course, has one of the most robust Medicaid programs in the country, covers more dental services than many Medicaid coverage plans do, but this isn't, it's not good enough. We need to ensure that people get the kind of care that they need. And we need to be attentive also to people with special needs. I have talked mostly about, I also had another point to add on teledentistry, which you know, I don't think that this will ever be a magic bullet for dental care. I mean, obviously, you need to get to somebody's mouth to deliver a dental service, but certainly during COVID, we've all learned the importance of telemedicine and teledentistry, but these will never replace the dental visit. So you've known about me from the probably overlong biography that you've all been given, that I've spent most of my working life focused on the unjust and unfair and preventable inequities in access to services and the achievement of health, particularly along racial and ethnic lines, but also these also parallel income lines. And there's no doubt that during COVID-19, when we saw an exacerbation of the length of life itself, Black and Latinos have lost 3 years of life expectancy versus about 1 for people who are classified as white. But I have no doubt that these have extended also to access to dental care services. And we in New York State don't have good enough data on this, but all of the data from national statistics suggest that Black and Latino and low-income individuals all have less access to dental care than people who have private insurance and have more money. They are much more likely to have untreated caries, 2 to 3-fold, more likely, and these are all preventable disparities and that we should and can be addressed with both restorative and preventive treatment. So I've talked mainly about clinical care services, but there are public health approaches to dental care. Of course, there's the fluoridation of water, which the Centers for Disease Control considers one of the miracles of the 20th century in terms of public health. It's really an iconic public health intervention because all you have to do is drink the water. We don't have to change people's behavior. You just put the fluoride in the water. We often talk about, we wish there were more interventions that were just like putting fluoride in the water. So that's one. But we also have done really great work through our schools and promoting the use of dental sealants in schools. I worked hard on that as the New York City Commissioner, expanding our school-based centers, health centers, ensuring that we brought dental services. New York City made the foolhardy decision of closing down its dental program, and I endeavored to do my best to bring it back into the school-based health centers. We also this year we're seeing the school-based health centers reopen, and they are an important place for young people to get dental services. We also work on primary prevention, our work of tackling sugar-sweetened beverages, for example, and promoting healthy food are all part of people having healthy teeth. This year's budget made some big advances in terms of expanding coverage in Medicaid, in both the essential plan and in health coverage for women after pregnancy. We've expanded that to a full year, which means that they also get dental services during that year. This is really an important addition, particularly for women who have substance use disorders. Many women manage to avoid drug use while pregnant. I think all women want to have healthy babies, but having only 3 months, 2 months postpartum of health coverage meant that women slipped back into drug use. And if you have coverage for a full year, we really think this is going to make a big difference. And of course, people who use drugs, people who use tobacco also are often get in trouble with their teeth. So it's going to be a good thing to have more coverage for these individuals. And we've also made a change in what happens when people turn 65. Where the income cutoff for Medicare was low. Anyway, people could have Medicaid coverage when they were 64 and then become ineligible for those services when they turn 65. So we've changed that so that people don't lose those services just by gaining an additional year. And we also will be improving our data. I know from a piece that appeared in something called the American Dental Association Huddle,
Yes.
that you placed among your top advocacy issues, the insurance reform, student debt reform, and health equity. So I would very much welcome a conversation about all of these. I've intentionally not said that much about COVID. The governor mentioned how important you can be in encouraging people to get vaccinated. We're doing not too badly, but we still have only 75% of all New Yorkers vaccinated. That includes a little children under 5 who aren't eligible for vaccination yet. And we're doing worse with boosters. It's standing just about 55% of people who've been fully vaccinated have also been boosted. So we have work to do. I really wish, like flu shots, that you could give COVID vaccines, but I don't believe that you have that kind of expanded scope of practice, but you can talk to your patients. And as the governor mentioned, they are a captive audience for you. When you're in the dental chair, you get to listen to the person who is working on your mouth. So we have some work to do. I have something about an infiltration certificate in my notes here, and I don't know what that is. So maybe during question and answer, somebody will raise that. But as we hope to turn the corner on the COVID pandemic, we continue to have as our main tools vaccination, masking, and social distancing. And I hope that I can depend on all of you to remind people that we continue to have these tools, even as we have determined that mandates are no longer needed. Every individual and everybody who looks after people and cares about their health can continue to remind people that these remain in our hands. So we have a lot of work ahead of us, recovering from the pandemic and building back our healthcare workforce. We have a great budget this year, one of the best ones that we've seen in many years in health, but we still have a lot of work to do. So with that, let me stop and hope that you'll have plenty of questions that I can address.
So Dr. Bassett, I have to say, incredibly comprehensive, which is no surprise coming from you. And we can't thank you enough for your insight, the information you gave, and certainly your involvement and your intentions. Certainly, I know from the NYSDA perspective, we're looking forward to serving together and working together for as long as possible. Let's just say that. We have several questions in the queue. I know, you know what, I'm gonna let Roy ask a question first because I know he'd like to start. So Roy, why don't you start off with one question?
Yeah, I have in the budget, which was a
Yeah.
very good budget. It was
It's a good budget.
sensitive to dentistry. And but in the budget, there's money for an independent contractor to review Medicaid managed care. And over the years, NYSDA has been very much, we sued two governors, Governor Mario Cuomo and Governor Pataki. We got 300 million in one suit, but that was in the old days when Medicaid was easy to understand. It was fee for service. This is what the person got, and you could look.
Yeah.
What counties had providers, which counties didn't. Well, in this age, it's hard to understand anything. So my question is, with this independent contractor looking at, will they be meeting with provider groups as well as?
You know, we had hoped to successfully get a competitive procurement of managed care plans across the counties, but that was proposed but not accepted by the legislature. And I'm not really sure of what this independent contractor is. So I'm gonna have to promise to get back to you, which I will. But I would guess that it has something to do with, you know, with trying to, we have a very fragmented system, as you're saying. There are not as many managed care plans as there were when I first started working at the New York City Health Department, but there's still a lot of them, and it's very, very fragmented. So we're all hoping to get more coherence. I mean, Medicaid is a huge issue for the state. It comprises about 80% of the health department budget. Not that we're spending it on ourselves, but we shipped it out. But it is, as you say, very complicated. It's an area in which I'm learning because it really seems designed to be impenetrable. It's very complicated. But the main point is that it should deliver the service that people need. And that I think we can keep pretty clear-eyed about.
Thank you.
Thank you, Dr. Bassett. Roy, you have maybe one more, and then I'll start taking some of the questions.
Yeah, one last thing. We for the last 7 or 8 years, we've gotten grants that are overseen by the health department, and we've been providing direct dental services, clinical services in Article 28 facilities. Well, this year, the money is in the budget, but it's unrestricted. So we're going to be looking for maybe a more cost-effective, broader application of the money that we had. And I think we worked with Dion Richardson, and I think we're going to be approaching you to look for some good creative ideas on how to use the money that's been budgeted for us to help the people who are underserved to the maximum way that we can. So we will be.
This is a good thing in your perspective that it's unrestricted.
Yeah, it's unrestricted. So in other words, we have the money, so we have to decide.
You have the money, you have to figure out how to offer it up. Yeah. Yeah. Okay. I mean, I didn't mention that we have, I mean, not only do we have in poor urban areas a sort of a deficit of dental health services, but rural areas also have huge issues. Yeah. And I'd be curious to know what you think, how you think teledentistry can address the direct service needs that people have. I mean, if you need your teeth cleaned, I mean, you have to have a person do it.
Certainly. And I think that may be a discussion, not necessarily for tonight, but certainly the vector to discuss between, I'll say the leadership of NYSDA and certainly you, Dr. Bassett, I think is there. So that could be something we could do very shortly.
Okay.
Very good.
Let me hit some questions from the audience, and forgive me, I'm going to read them. Excuse me.
I can
also start one from a Dr. Tegmeyer. Commissioner Bassett, are you aware of the 2 to 3 year wait for people with intellectual and developmental disabilities across the state who require regular dental care in an operating room? And if so, are you aware of any initiatives at Department of Health to rectify this longstanding issue that endangers the health and well-being to one of the most vulnerable populations in New York State?
Well, this issue appeared in my talking points, but I confess that I don't know what the solution is to it. So I didn't talk about it because I really don't like talking about problems for which I haven't got a solution. So it's come to my attention, and I don't quite know what the origin of the long waits is. Is it the lack of coverage? Is it the lack of operating room space? Is it the lack of providers? I'm just not sure. So anyway, I made a note of it as I looked over my notes before this meeting, and I will make another note of it now.
And that's something, at the risk of saying, with someone like Dr. Tegmeyer, who is really at the forefront, that may be a conversation that the two of you could have. You know, certainly Roy and I have a lot of information, but there are many people within the umbrella of NYSDA who have a finite or a tremendous amount of information in a finite area. And Dr. Tegmeyer is certainly one of those individuals.
Okay.
Let me bring up another question.
This is Dr. Tegmeyer.
Carl Tegmeyer.
Okay.
And certainly we could give you all the context that
That would be great.
Yeah, and I'm sure Carl would be ecstatic to be able to have that conversation with you.
Okay.
As you know, I will say this, between Dr. Tegmeyer, we have certainly Dr. Miller downstate, who deals with a lot of the special needs issues. It's such a tremendous group where we have a tremendous focus, but we need direction. Roy, I see your hand is up.
Yeah, just to note, the governor did include $750,000 in this year's budget to fund education and training for dentists in this area. But of course, that's only looking at one side of the issue. You have the education and training, but you need the facilities and the reimbursement. But it was addressed by the governor in her budget, and hopefully we can work with Dr. Bassett going forward on this.
All in the right direction. All right, let me hit a second question, which is actually from two different people. First from Dr. Queen, but then I'll chime in with another one. The first, would you support fluoridating water supply statewide? But now let me read another one, which is on a similar plane. You mentioned fluoridation. This is from Dr. Palmaccio. You mentioned fluoridation of the water and the numerous benefits associated with that. Are there plans to reintroduce water fluoridation and dealing with the various groups or the political opposition to such measures?
This is new to me. I didn't realize that our water wasn't fluoridated. I didn't know that.
There's a large group of anti-fluoridation.
Well, I consider that very unfortunate, but I just don't know enough details about it. So New York State water is no longer fluoridated?
It depends on location, if I'm correct.
I see. So some areas have not. Okay. I mean, the studies that were done now decades ago, I think were really convincing that fluoridation was helpful. And as I say, I was really citing the Centers for Disease Control, which I consider our federal, our federal public health agency that gives guidance to the nation in summarizing what they considered the great advances of the 20th century. That they included that. So I don't know what the concerns are about it, and I don't know what the role of the state is in it. I will thank you for bringing that to my attention. I've been hearing all about PFAs and water and things that are sort of 1 part per trillion per billion. So there's a lot of concern about drinking water quality, but I didn't realize that it extended to fluoride.
And this may, again, unfortunately tonight that we can only touch on certain things, but this may be a conversation with you and certainly whether our leadership or those individuals who have.
Sure. Does the association have a position on fluoridation? Or has it become,
We approve of fluoridation.
Yes, I mean, I just don't know any public health person who doesn't.
Yeah, but there are many advocate groups out there. It's without getting too deep in the mud here, it's a similar thing with something like amalgam restorations in the mouth.
Okay.
There are anti-amalgamists out there, and typically the reviews that are done every few years prove that amalgam is still a viable material to use.
Yeah.
Let me hit another one. This is from Dr. Bajor. And I'm going to cut through some of it. As a pediatric dentist who provides care to the very young children and patients with special needs in the OR, it It is becoming increasingly difficult to get insurance companies to pay for anesthesia and hospitalization. Several OR facilities limit access to dentists or deny OR time, and special needs patients have nowhere to go. How do you think you could help us with this challenge? It's similar to
This
the
is
other.
the same, similar to the other question, and I just have to learn more about it, but I appreciate that.
Okay. So
I
it's
appreciate
in
it.
the form.
Now it explains more about what the barriers are, that it's getting to the OR. It's it really is access to services. And so are these kids who have to be put under general anesthesia in order to perform the
Correct.
procedures that they need because they can't otherwise cooperate?
Correct.
Okay.
Let me hit another one, and I just mentioned this is from a Dr. Leary, and the only reason I will emphasize that Dr. Leary, with hopes from New York State, will be the next president-elect of the American Dental Association. New York really has some incredible talent and individuals who have the focus, like we've discussed earlier, on doing what's right, not only for the public,
Right.
but for the profession and everything involved in that. So from Dr. Leary, are there any ways you feel we could partner and assist you in the delivery of the best dental care to patients we treat? Public health issues you would like to foster here in New York State?
Well, that was part of the reason that I accepted the invitation to come talk with you this evening, because I'm hoping to open this channel. As I say, I absolutely do believe that we need to deliver high quality oral health care to the people of the state, and they know that they need it. And we in public health should do more to respond to that felt need. We have so much work to do. Obviously, the crises of COVID and the opioid crisis are ones that we're dealing with now. But we also have the long legacy of non-communicable disease, which remains the leading cause of death. But I don't think that we should only use death as the indicator of what's important. We should also think about quality of life. So I'm very interested in how we continue to use the schools as a venue to promote dental health. As a child in New York City public schools, we're seen by dentists, and that doesn't happen anymore. Yeah.
So, I always hesitate to answer a question or to ask a question that there may not really be an answer, but I'm going to throw it out there because we have a couple along the similar lines. What role, if any, can New York State Department of Health play in increasing the pool of qualified dental staff, particularly assistants and hygienists? Now, I'll add to that myself. Much like with the hospitals now, a lot of our staff has become very limited,
Right.
Which certainly limits the amount of care we could give to the patients.
Yeah.
Is there anything that may be a focus for New York State?
Well, I as you're saying, this year's budget put a huge amount of money, $10 billion over 5 years, into building the healthcare workforce. And I don't know where dental care fit into that. So talking with you this evening, I'm realizing, we have some things to promote diversity in medicine, and to do loan forgiveness for both the doctors and nurses who work in high need areas, underserved areas. But I don't really know whether dental services made it into that. So obviously, so I need to find out for you. I don't know.
And that's perfectly fine. I'm going to throw out another one that may just be, again, another conversation for another time. But one of the individuals wrote about maybe a program in the Syracuse area.
Yeah, I'm seeing, and I heard, I was talking to a representative from Syracuse who is really interested in another health-related, training institution that would be based in Syracuse.
Well, we have seen one hygiene school that is now opening up in upstate, but the end result is and this may not certainly be under your umbrella, but maybe the consideration for New York State to look to building more programs of training, whether it be for hygienists or assistants.
Right.
Certainly, it's a wonderful career, and the training is where the lack is.
Right. Okay. Well, that's a good point.
Here's another great one from a Dr. Zhonke, okay?
What are your long-term goals? All right. So the overall goal of the department is to protect and promote the health of all New Yorkers. And that is a very expansive agenda. In public health, we used to say that it goes from A to Z. We worry about the air you breathe to the zoonoses that you're exposed to. So within public health, we're looking forward to a return to focusing on non-communicable diseases, and of course, focusing on the opioid crisis. Within Medicaid, I'm, very interested in the ways in which we can both expand benefits and expand eligibility. Some of that was accomplished in this year's budget. And I'm also interested in our role as a hospital regulator and of other health services, just in looking at how we can more effectively tie hospitals to the health of the population. These have been too siloed. So those are sort of in broad strokes, the priorities that I have. And of course, across all of them, we have the challenge of reducing the gaps between racial, ethnic minority groups and the poor, which also include people who are classified as white.
Gotcha.
So that
Roy,
applies to everything. So,
Roy, I'm sure you have some other questions. I have more too, but why don't I give you an opportunity to ask another one?
Well, I wanted to answer her question about fluoride. New York State used to mandate fluoride statewide, but then maybe 15, 20 years ago, a movement came through that it shouldn't be required. A county should be able to opt out. And so you have localities that opt out of fluoride. Albany, the city of Albany is not fluoridated. And I think one of the questions coming up is that that's going to be coming up for a vote. So unfortunately, New York City has always been fluoridated.
Yeah, I'm from
it's
New
a
York
crazy
City.
quilt. It's a crazy quilt, and it'd be great if we could get the mandate again, but it's a very hot political question.
Political, yeah. I lived in Southern Africa for numbers of years, as probably somebody noticed. And
incredible resume.
And I was there for a long time, raised my kids there. And but we did have there you could see fluorosis. I think that's how it's pronounced, but I mean, that's extremely rare. It's extremely rare. I just yeah.
Something in your optic, though, certainly. Let me ask another one. At New York State dental schools, we are losing our most talented students to private practice, even if they wanted to pursue a career in academia. They simply cannot afford to do so because of the burden of student debt accumulated.
Yeah.
Most of our faculty currently is recruited from other countries where dental education is free or where only minimal charges have accumulated when students graduate from dental school.
Yeah.
Are there plans that New York State have to make it easier and more appealing for our domestic students to join the academic workforce? And I think a lot of this is from a Stefan Rule.
Yeah.
I think a lot of this has to do specifically with student debt. These kids just
no, it's terrible. It's terrible.
These kids are coming out anywhere from $350,000 to $650,000, $700,000 worth of debt.
No, I mean, and it's it's everywhere. People are accumulating unconscionable amount of debt, and I'm told that it exceeds credit card debt in the United States now, student debt, or at least is sort of neck to neck. So where kids are coming out at the beginning of their working lives already with a huge mortgage, so to speak. So this is obviously a broader problem than just a health department can address, but there's no doubt that it's a huge one. And and also young people are rebels, and the people who we want to have taking chances, and to have them so terrorized by the amount of money that they owe seems to me to have the potential for really broad social repercussions. Not only depleting the ranks of academia, but just people who are challenging becomes frightening because you're afraid to risk your career in any way. So I'm very worried about it, but I don't know, and I don't know whether this is really an issue for the governor. If we know that the state universities are less expensive than the private ones, but it's still far too much debt. So all I can do is say that I affirm that this is a real challenge, but it's one that needs to be solved more broad politically, frankly. Can't just be a health department that does it.
Understood. So I'm going to say we have about 5
I'm glad you
minutes
have it
left.
on your advocacy agenda. It's really disabling to us.
Certainly.
Yeah.
We have about 5 minutes left, and I realize
Oh.
we should have probably booked about 2 hours, given the number of questions we have. So I'll throw out a couple more, and then we'll probably get to a point where we'll have some closing comments. So NYSDA has been carefully studying and following the proposed single-payer New York Health Plan Act, the brainchild of Assemblyman Richard Godfrey. How do you view this single-payer legislation and its impact on the Department of Health if it enacted?
Well, I probably the questioner knows that I'm on the record as supporting the Single Payer Act, something that is not shared with the governor who appointed me. So what's happened in the most recent budget is an expansion of health coverage. As a state, New York State does pretty well. We have 95% of the people in this state have healthcare insurance. About 900,000 people remain uncovered, and about half of them are people who are undocumented, a class that's been excluded from public insurance, but which in this year's budget we extended for the first time to a new class of individuals, people who are 65 and older. So, I am a believer in government funded, publicly funded government-run health insurance, something that is used by many Western countries. But we are pretty close to having full coverage. The problem is that even with health insurance, people experience economic barriers to care. And we've talked about some of the reasons. Part of the reason it's hard to get dental care is because the practitioners can't make ends meet on a Medicaid population. And so somebody has insurance but can't find a provider to give them care. And so that is not a successful system in my view. So we still have people who have barriers to care even when they have health insurance coverage. They have copays and deductibles, and the cost may be huge. Something else happened good in this year's budget. There was something like 69,000 children who lost health care coverage because their parents couldn't pay the copay for their insurance coverage. We have near universal coverage for children, the Child Health Insurance Program, but these were families that couldn't pay the copay. I think it's capped at $30 per family, but when you're poor, $30 can be a lot when you're managing paycheck to paycheck. So we got rid of that, and families no longer have a copay. So those kids who lost coverage because their families didn't pay won't be disenrolled, and all the 100, I forget however many more children there were whose families did manage to pay, also now won't have that copay. So we're chipping away at this, but I hope I've given a clear enough answer. We're all for progress, even when it's not perfect.
Thank you, Dr. Bassett. I'm going to hit you with two more questions and then we'll finish
Sure.
up. I'm sure we've exhausted you at this point.
No, not at all. I just have I'm feeling rather underprepared for meeting with all of you. So
Oh,
I've
no,
been writing down all
actually
the questions. So
I disagree. I think this has been absolutely phenomenal. And I think it's the start of a relationship that I think could be very positive for all the people of New York State.
good.
So-
Yes, I thank you. Good.
All right, two quick questions, which I say quick, I'm sure they're not going to be. One is from our immediate past president, Dr. Craig Ratner. The profession of dentistry is currently regulated by the Department of Education, yet physicians are regulated by the Department of Health. There was movement this year to correct this, but never made it into the budget. Do you have insight into this strange phenomenon and its possible future?
Well, as you know, we as a department advocated that the health department, which should license healthcare workers since it also regulates them. But the licensure is overseen by the state education department, and the legislature did not agree with us. So there is an agreement that we'll, I don't know, streamline things, or I have a lot of respect for the education commissioner, but on this one we disagreed.
Understood. All right, let me ask one last question, and then Roy can maybe say something, and then I'll certainly close. NYSDA, and this is certainly right up your intentions. NYSDA has received a $125,000 grant in the state budget for unrestricted use of funds administered through the Department of Health to support our dental demonstration project goals. What do you see as worthwhile projects that NYSDA could collaborate with the department on to promote dental public health?
That's such a good question, and it's one that I don't have the answer to. I mean, I think that we should be doing better with dental sealants, but I know that not everybody agrees, at least when I was a New York City commissioner, that these are the kind of silver bullet that that they were once thought to be. I really wish we had a better handle on the dental health of kids in schools. Just old-fashioned missing, decayed, and what there's an acronym for it. Is it missing, decayed, filled teeth? Just old-fashioned open your mouth and scan the teeth type surveys. And I really think that schools are a great place to reach children who have parents who are working multiple jobs to keep the family afloat. I don't think we should blame parents for not getting their kids to the dentist. We should try and take advantage of the school setting as a place to give those services. So those, those are, I don't know, those are the things that immediately come to mind. There's also, I don't know, as a profession, whether you're engaged in what they call in the international community sort of task shifting, trying to, give, I guess dental hygienists do a lot, but if there would be any possibility with scope of practice constraints and trying to expand the role of dental hygienists so the dentists can work at what they call, at the top of their license. Yeah, I don't know. That's literally off the top of my head.
One of the last, this is the last thing I'll ask, and then I'll defer to Roy for a moment. But I'm going to twist this around. Dr. Jean-Pierre, does the health commissioner have a question for us? Now I'm going to say it in a different way. Given tonight's conversation, which I think was absolutely wonderful, I'm going to say, I think there's probably a good suggestion in saying, what can we do together? In other words, I think maybe another meeting, not in a form like this as a webinar, yes, but maybe you and the line officers or the board can sit down and really work on what's best for the Department of Health, what's best for NYSDA, but more so, how do we pair together to do what's best for the population of New York State? I think that would be a phenomenal meeting.
I'm saying yes, absolutely.
And
absolutely.
The invitation would go to all the other stakeholders that you think would be appropriate to be in that room. Roy, you have anything you want to finish with?
Two quick things. Number one, thank you very much. We will be in touch with your department on that grant, but just as a point of information, we have just, you mentioned dental hygienists. We have just passed a bill in both houses to allow dental hygienists to do infiltration, anesthesia, and nitrous
Oh, is
oxide.
that what that was about?
Not, yes, I know.
see.
Not-
Okay.
Not just on hygiene patients, but
Okay.
on any patient. So that will allow dental hygienists to be more functional and work at a higher level than they do now. And that's probably where you know, somebody.
That was
briefed-
what I was getting at.
Yeah,
Yeah.
yeah.
Yeah. Well, that's
Okay, well,
great.
thank you.
Congratulations. Yeah.
Thank you.
So let me now say a few things. Certainly, Roy, thank you for setting this up. Thank you for your participation. I apologize to the group of those that asked questions that we couldn't get to, but we will address those questions. I'm sure Dr. Bassett and I and the line officers can
Yes.
have that discussion.
If you could
Dr.
save the
Bassett?
chat, if you could just save, there's a way to do it.
Our
Whoever is.
staff, I'm sure, is on top of that.
Okay,
I have to say to you,
Yes.
NYSDA staff is, in my opinion, the most amazing, comprehensive, and really has the focus on doing what's right, again, for the population of New York. So with that said, Dr. Bassett, I can't thank you enough. I'm sure everyone on the call thought this was a wonderful interaction. I think the conversation still needs to go on, but very simply from Kevin, thank you so much, because this was a wonderful, wonderful event. One of the best
Thank you.
webinars I've been on. So, and certainly congratulations
Thank
and good
you.
luck with everything. And we
Thank
look
you.
forward to a long-standing relationship. So thanks again.